I am Dr. Jay Hitson, Clinical Director at Blue Umbrella Medical Center. We started doing exploratory blood panels about 5 years ago, and when we started this whole process, it was interesting and intriguing. I never thought it would be the life force that we have seen it evolve into. First off, one of the reasons we wanted to start doing these particular exploratory panels is because, as a general rule, you cannot test for things that don't have symptomatology. So, for instance, before we can test for any kind of liver damage, you have to have symptoms of liver failure. Well, the liver doesn't have symptoms until it's well into the disease process. So there's this huge margin of time where we could be intervening and doing preventative work if we just knew that that was the issue. So with the exploratory panels, we can test virtually every system in the body and find out how each system is functioning on a biochemical level. The blood will show things way before your body starts showing symptoms. And half the time we don't even recognize the symptoms, even if you are experiencing them, because we're just not aware. Over the years of doing thousands and thousands of these, first off, being able to understand and diagnose emerging health conditions before they become actual disease processes, not just waiting and seeing, or we're just going to monitor this like the typical healthcare lingo, but actually working right away to reverse that. And reversal can be done far simpler than most are aware of. Changes to diet, exercise, lifestyle can make a huge difference, and that makes sense to most people. When you already have major heart disease, what is one of the things you have to do? You have to change your diet. You have to start exercising. Well, if diet and exercise work after the heart attack, wouldn't it work before the heart attack? Of course it does. And the panels show that. And then within 90 days, we can actually start to see these major disease processes reversing with simple, non-invasive, non-pharmaceutical approaches. And it's incredibly not only effective, but cost-effective. We've seen lives change by just implementing the right foods and the right supplementations, or taking away some of the things that are actually being very, very harmful. Not all medicine needs to be pharmaceutical intervention. I have thoroughly loved and enjoyed being able to be such a catalyst for change in thousands and thousands of patients' lives. And it really is a great starting point for so many who are experiencing symptoms, but they keep coming back with, your tests are normal. There's a lot of reasons for that. And we're able to give people answers, give them actionable solutions, and frankly, we're able to give them their lives back. So that is one of the joys that I have had, being able to work with these particular blood panels and being able to work with so many amazing patients over the years.